Welcome back to The Blend, a podcast brought to you by the Journal of the Dermatology Nurse Practitioners and Physician Assistants. For its second year, The Blend is returning in a streamlined format designed for smarter, faster listening. In this episode, host Dr. Sonal Choudhary, director of the Integrative Dermatology and Skincare Clinic at the University of Pittsburgh Medical Center, chats with Dr. Carolyn Willis on all things regenerative aesthetics, from exosomes and nanofat to red light devices and everything in between.
Welcome back to The Blend, where we explore the science, the nuance, and the whole person approach to skin health. On this podcast, we love sitting at the intersection of evidence-based dermatology and integrative thinking, especially when it comes to how skin changes across time, hormones, and healing. And today's conversation really embodies that spirit. I'm thrilled to welcome Dr. Carolyn Willis, a board-certified dermatologist whose career beautifully bridges rigorous science, regenerative aesthetics, and whole patient skin health. Dr. Willis trained in dermatology in New York and completed a highly respected fellowship in cosmetic dermatologic surgery at UPMC under Dr. Susan Upagi, where she developed deep expertise in procedural and regenerative skin treatments. What makes her perspective especially integrative is her strong foundation in immunology and investigative dermatology, and has published so many research papers on autoimmune skin disease and inflammation. She's also an academic contributor to leading cosmetic dermatology texts, and her work spans from chemical peels, fat augmentations, and advanced procedural techniques. Now she's practicing in Pennsylvania as the owner of Mars Cosmetic Dermatology and as an instructor at UPMC. I welcome Dr. Willis, and I will straight off give you one question that I want to know all about, Dr. Willis. When people say regenerative skin treatments, what are they actually talking about? And what is the main difference between platelet plasma, exosomes, secretomes? Are they really different?
So thank you for having me. Absolutely. I think that this is an important topic and it's a evolving topic. And I think more and more people are getting interested in it across generations. So I know that we talk about this as we kind of get older, more towards the menopausal years, but younger people are realizing that if we start things sooner, maybe we don't have to do so much as we get older. But I think when people say regenerative skin treatments, they usually mean procedures that are targeted towards stimulating your skin's own repair and renewal systems. So not just covering up the damage, but making durable and real change to the skin. But it is also important, to ask people, when I have patients coming in looking for quote unquote regenerative treatment, what do they mean by it? Because what I mean may be something different. And so they may be looking for a different type of treatment series that what I'm going to offer them is not what they had in mind. So I think it's important to make sure that everybody's on the same page.
So absolutely, meeting where the patients are is been the crux of how I have continued to practice. And sometimes what I think is the right answer is absolutely not what they're looking for. So if your patients ask about what does PRP do, or what is exosome or secretome mean in like the simplest terms, how do you explain it to them? If they come having read a little bit about it, how do you explain this to them?
So I think that all of that is definitely kind of where we're going in terms of they are biologically active substances that are used to induce a therapeutic change on a cellular level in the skin. So we're giving our cells direct biologic messages to do a certain thing. So they differ in some, pretty nuanced ways. Some are a bit more broad. So PRP, or platelet-rich plasma, that's autologous, meaning it comes from the patient itself. So that requires a blood draw. We draw some blood, we separate out the growth factors, usually by spitting it in a centrifuge, and then, pulling out that platelet rich fraction. PRP, though, is what I think of as like a general wake-up call for cells. So it's whatever bioactive molecules are present in your serum at that point in time. So it's a mix of peptides, proteins, cytokines, growth factors, and we're using that to hopefully promote healing and tissue repair. It's also used to stimulate the hair growth cycle. So because the PRP comes from your own body, it really is the robustness or the efficacy of it depends on your health and what your blood is doing for you on that day. So that's to be contrasted with the secretome and the exosomes. So those are usually more allogeneic. So it's developed from donor tissues or a cultured cell line. The secretome is just a complex collection of all the substances, so protein factors, growth factors, hormones, and exosomes that a tissue or organism releases into the surrounding extracellular environments. So exosomes are part of the secretome of a tissue or an organ or a tissue culture. An exosome is what is an extracellular vesicle. So it's basically a tiny little lipid or fat bound pouch that's full of these biologically active molecules, so proteins, but also little snippets of RNA and DNA. And they act as messengers to tell the cells to repair, rejuvenate. They modulate the skin response. And they're pretty ubiquitous across fluid types in our bodies. So they're fine in, diverse substances, cerebral spinal fluid, it's in breast milk, it's in joint synovial fluid, in our plasma, of course. And so they are just a part of the secretome. So we do have exosomes that our own body makes, but when we think of them in regenerative cosmetic practice, we are actually using exosomes that are produced from an exogenous source, not from the body.
Yeah, thank you for explaining that, because that is often a question that I am asked, and I often defer this to our cosmetic dermatologist teams, such as yourself. So I'm glad that the patients are getting this explanation. And actually, that brings me to my next question, which is, what does the evidence actually show about this? And, are we really getting ahead of what the data available on this subject is?
I do think we are getting a little ahead, especially on the exosome part. I would love to just have a closet full of appropriate exosomes to target a specific indication. So the beauty of exosomes versus PRP is that exosomes can be created by stimulating that tissue culture or what have you with certain factors, temperature, pH, to produce those biologically active molecules within the exosome of a certain, a desired composition. So they can be very targeted for what you want to tell that healing tissue to do. So they're the future if we can prove that they are safe and effective. There, however, are not a lot of high quality long term studies looking at their safety and efficacy. But I think we're getting there.
That's good, because, we're going to need some of these when people are already using a lot of these products out there. And I hear mixed results, honestly, from our patients. And every time, you attend a conference and you see different new products out in the market, I have a lot of curiosity around them. And then I talk to an expert like yourself, and, I would ask you this: where do you see something like that? Some of these new therapies fit alongside retinoids or the devices, injectables, and so on. And also lifestyle interventions. Like if we're talking about, for example, a lot of, the GLP-1 drugs are helping people treat their diabetes, also like for weight loss now. But like, for example, that comes with, hey, you still have to build your muscle. You still must do resistance training and make sure you're watching your diet the whole time. You cannot just do that in isolation. Otherwise, it can be a pretty destructive process in the long run. So similarly, we're using that as an analogy here. Where do these type of therapies fit in now, and maybe even in the near future, with our existing anti-aging and regenerative therapies?
Yeah, I think they complement each other. So when we're doing, rejuvenating, regenerative treatments, often we rely on technology-based procedures or device-based procedures, things like a fractional carbon dioxide laser or chemical peels or microneedling or radiofrequency microneedling. And so those treatments are, predicated on making some controlled injuries to the skin, and in so doing, stimulate production of collagen, elastin, cellular turnover, and proliferation. And it would be amazing if we can tell the body with, say, a properly produced exosome containing the exact growth hormones, cytokines, anti-inflammatory factors that promotes the most optimal healing from that treatment that we've done. So I feel like down the road, it will enhance the results. The PRP, which we do now all the time already with things like microneedling or CO2, we're, like I said, we're limited by what's present in the body itself. What I do want to also give a shout out to is just something we haven't mentioned is nano fat. And so, also autologous, meaning taken from our own bodies, but rather than just harvesting blood, we harvest a patient's own fat. And rather than, enzymatically kind of break it up to inject it, we mechanically put it through a number of filters. And what that allows is that the adipose derived stem cells that are present in our fat are still intact. And so we can then take that and inject that into the skin. So rather than things like exosomes and PRP, where we're just giving the skin that improvement for a moment, we're actually transferring stem cells that can differentiate into a variety of skin cells and gives us more durable response. So I feel like in regenerative medicine, besides, I feel like I'm hoping we'll go more towards harvesting the body's own healing potential by using those stem cells more.
Yeah, I mean, the stem cells have always been a very important topic of conversation. I want to go back in time when I was a resident and I was talking to one of my brilliant, but a year junior to me, co-resident, who does a lot of research with stem cell. As a PhD, MD PhD, and was telling me the concerns that he had personally with working with stem cells or how it would become as a regenerative therapy soon. But the fact that you really cannot still control the differentiation of the stem cell into something specific was something that he was really concerned about. And he had cited this example of a patient to me that I would never forget. And I'm still wary of this whole thing because my first introduction to the topic was that, it was expected to make, I believe, fat, but it turned into bone. And then it was sort of, poking into the eyeball because this was done on the face. And I was like, wow, like that is scary and incredible at the same time. So he said, until and unless you can fully control the signals to let it become the right thing that you're hoping for or wanting to, it can be dangerous still. So, that really leads me into asking you this. In your own practice, can you give me a couple of examples? So, some of us practitioners who don't do necessarily a lot of cosmetic dermatology, but refer our patients to experts like yourself, what insights should we give them before sending, like what expectations should we set for them so they don't arrive in your clinic and they have these really high expectations because we said, hey, we have these experts and they can sort of answer all your questions but also provide you almost with what you're looking for. Obviously we don't ever say that exactly like that, but how do you want
Yes.
us to set those expectations about these new techniques and therapies that are coming out?
Well, I mean, I think it's important to know that, there's not one and done, and that for best results, it's really kind of a whole lifestyle commitment to improving oneself. Because if you just focus on the skin, you're never going to get to the end point that you're truly looking for, because it's really, we're not just skin deep. So what's going on internally is also being reflected on our skin. And so being realistic about what our endpoint is and what we're going to have to do to get there, I think is very important. um, you know so many of these, especially social media and such, they promise these wonderful things, but I think people need to realize that it's not a rewind per se. For a lot of these treatments, it's maintenance. So although we will get it better, we're not going to reset the clock back 20 years. I think we're getting, better and better and safer with our treatments, but a realistic commitment to skincare, procedures, topicals, sun protection, healthy lifestyle. I think you really need to, impress upon the patient that it's not a simple thing.
Great. Any other advice that you give as a prep for a person who's trying to do that, such as, how when we're going in for chemical peels, for example, we'll tell patients to use retinoids and then kind of build up to that. So when they get a chemical peel, they can get best results. Is there anything like that, which is almost like a prep for regenerative therapies?
So I love retinoids. I mean, I think they have been around for decades, and we have lots of good data to support their use for anti-aging purposes. They go right into the cell, they affect DNA expression, stimulating cellular turnover, triggering fibroblasts, or actually producing new collagen. The visible improvement does take a good 3 to 6 months. And so a lot of people give up before they could get the results. But in advance of a procedure, studies have actually shown that if you've been using a retinoid, say, even 3 to 4 weeks before a fractional CO2 laser resurfacing, you actually heal quicker. So it speeds up wound healing and reepithelialization, and it also decreases your risk of post-inflammatory hyperpigmentation and milia, tiny little cysts that can sometimes form. So I think, and I also think that having a good skincare and somebody who's stuck to a good skincare regimen in advance of a procedure is a good marker for a good patient. And if they're willing to do what they need to do before, then their outcome from that procedure and their compliance with aftercare and maintenance is going to be better than the person who shows up having done no pre-prep and then just want to jump in the procedure and not maintain it afterwards. But there's lots of other topicals we can add there that I recommend. So I mean, resveratrol is another good antioxidant, anti-inflammatory, vitamin C, anti-inflammatory, anti-pigment. If they've got pigment issues, I will often start them on some tranexamic acid topically. And if they have lots of pigment issues, we even talk about whether it's safe to use it orally for 6 to 8 weeks in advance of a procedure and maybe 6 to 8 weeks after. And so depending on the procedure, there is definitely pre-prep that we do to optimize the results and to increase safety.
Thank you so much for going through all of those. But because we have you as the expert, and a lot of my patients ask me this question, I cannot not ask you this question. What is a good skincare regimen? What does that mean? I know sunscreen is part of it, but what else according to an expert like you?
So for me, I always tell people if you only have two products, it's going to be your sunscreen, preferably a mineral-based SPF that's tinted. I like the zinc or titanium oxides. The tint is important because it would also protect you against visible light. And especially in darker skin tones that are prone to hyperpigmentation, we're starting to realize that those high intensity light, the blue light that's coming out of our phone, all of that can trigger pigmentation. So, using a tinted SPF with some iron oxide in it is going to give you that added layer of protection. So, that for sure. So, your sunblock and then your retinoid, because we know that's our number one anti-ager, can also normalize not only the structure of the skin but the skin appendages, so less potential oil, and kind of normalize that, so it can help with acne, can also help with scars and even out the skin texture. But then again, like I said, you do need anti-inflammatory. So pick something that has either an antioxidant like vitamin C or vitamin E. Peptides, which we can have a whole nother discussion on, topical peptides, injectable peptides. But for topicals, looking for ones that maybe will support nutrient into the skin, like copper peptides, things along those lines. So I like a retinoid, I like an antioxidant, and I like a peptide. And depending on the skin, maybe a little alpha hydroxy acid to kind of get some more cellular turnover. So it depends on the skin, but definitely morning, sunblock, vitamin C, peptide, and makeup if you like it in the evening, cleanser, another antioxidant, and your retinoid, and then moisturizer if you need to, because we do lose a lot of moisture at night. So it's important to moisturize overnight, in my opinion.
That's a pretty solid regimen. And I think I'm missing a few pieces in my care. So thank you for that. I will be adding them. Retinoids. Now, retinoids are not always equally tolerated by every single person in the same way. We know that. And I have so many little caveats on how I share that information. We write it down. I tell my patients to start with a quarter of a pea size amount. We talk about short contact, all this. But if somebody can just not tolerate a retinoid, do you have another option for them that they can use for similar results, or at least in that direction?
So I always tell my next best is retinaldehyde containing products. So you have a number of choices for over-the-counter retinoids, and you can either be retinol, and that needs to be absorbed into the skin and then undergo two conversions within the cell to become active retinoic acid or retin-A tretinoin. Right after that, it goes from retinol to retinaldehyde to active retinoic. So retinaldehyde is a little bit more potent than the over-the-counter retinols. So for patients who really cannot tolerate that tretinoin and Retin-A, I tell them to look for a retinaldehyde containing one, because if they can tolerate that, that's going to probably be your closest that you can get to active retinoic acid or Retin-A. If they can't tolerate that, I tell them to back off and try the retinol. And if they can't tolerate that at all, I tell them to go to another botanical like bakuchiol, which I don't think is as robust. Some studies show that it is as effective, but in clinical experience, I really have not seen it to be on par with the retinoids.
That's something that we actually looked into as well recently. I usually pronounce it as bakuchiol because that's what I have heard being. Yeah, but that is good to know. Some people might say that, and I'm glad to hear that's another way of saying it. So I don't say I don't understand it. So great. So the bakuchiol option, I agree with you 100%. It's not as strong. It is not definitely as efficacious, but for someone who's totally struggling with retinoids, it might be at least a good start and then make their way into it.
Absolutely. And it's a nice additive too, because I think that, using products in the morning with that has it in it, like I know there's a lot of like CC creams, tinted products, even some foundations. I think it gives you that added layer of cellular turnover. So I have patients who, use it in the morning, but they're using the Retin-A at night and they tolerate it very well. So I think it's a good addition.
Wonderful. And my last question to you today is about red light. Do you ever recommend the red light masks, or if someone asks, do you encourage them, discourage them? Are you neutral for them? Or do you ever include that in your toolbox for the patient?
So I think that's a great question, because I get asked probably daily about the red light masks. Are they efficacious? Do I have a brand favorite? And I have to say, red lights, which is just a wavelength of light, usually 630 to 830 nanometers, studies do show that they can improve skin aging by stimulating collagen production. And in doing so, they can reduce wrinkles and they can increase skin density. They can also promote hair growth. So they're used for both skin texture as well as for hair growth. And they do have studies showing that they actually do stimulate follicular stem cells and increase blood flow into the scalp. Most studies, though, are small, and the ones that are a little bit larger are often manufacturer funded. So it's very hard to find true objective, and definitely there's no head-to-head data of different devices that I've been able to find. But they seem to be safe and can be effective. They do need to be used for many months before people see treatment, and you have to use it according to the manufacturer's instructions, because you can overuse it and you can get some sensitivity, you can get some irritation, and you can get some pigmentation. And so, as I said before, those who are prone to, with high energy visible light, so that's going to be in that spectrum, that red light for darker skin tones can worsen melasma, for example, or other pigmentary disorders. So it may be that red light is not a great idea for those prone to hyperpigmentation. Also, people who are on photosensitive medications, certain blood pressure medications or antibiotics, risk for photosensitive condition reacting to that. And also, other photosensitive disorders like autoimmune disorders like lupus, red light may not be the best choice for an anti-aging regimen. But what I do tell my patients, if you want to try it, give it at least, 4 to 6 months, because continuous use, diligent use, according to the manufacturer's recommendation, is what's going to be needed to see results. And also make sure it says FDA cleared on the one that you buy, and that you're always using eye protection when you use it. You want to make sure you protect the eyes.
Mm-hmm. Yeah, that is very helpful to know. I have a small list of things that I go over for red light if somebody asks me similar questions, and it includes most of what you were just mentioning. Well, thank you so much for answering some really almost rapid fire questions about things that I guess that get asked about every day. And I think all the future of skin aging is moving towards, evidence-informed and patient-centered approach. We should encourage that.
Thank you so much. Thanks for having me.
We hope you learned a lot from this episode of The Blend. Thank you for listening. Check back soon. We're dropping a bonus episode where Doctors Choudhary and Willis discuss the hottest aesthetic topic out there, peptides.